The waiting list of over 7 million people and over 400,000 people waiting over a year for treatment. The NHS is under unprecedented pressure. NHS vacancies have also reached 133,000, with just under 10% of NHS jobs left vacant, making the challenge to clear that backlog even greater. This includes around 10,000 vacancies for doctors. Earlier this week, Conservative MP Anthony Browne opened a debate about the need to train additional doctors, and I'm delighted to say that Anthony joins me now. Anthony, obviously this is something you have identified. I was quite shocked when I read the debate and read into some of the issues that you were raising about the scale of the issues with the lack of doctors.
It's enormous, and in my constituency in South Cambridgeshire, I've got 2 hospitals, I've got a lot of medical research institutes, and I know how desperately short of doctors they are. You mentioned that there's 10,000 vacancies for doctors across the UK, but actually it's even worse than that in some instances, in that the Royal College of Physicians did a survey recently, and they found that when hospitals advertised consultancy posts, in 52% of cases they couldn't fill the post because there was no one available to fill it. So, and that causes huge harm to patients. Obviously, it makes it very difficult for the NHS to deliver the care it's meant to deliver. And the frustrating thing about this is that it's actually basically been a deliberate government policy for decades not to train enough doctors that we need as a country, because we know that we can just get doctors from overseas where their training is already paid for overseas. And so the General Medical Council, which all doctors have to register with, more than half the doctors that register with them every year are actually not UK trained doctors. They're doctors trained in other countries. And obviously the NHS couldn't operate without these doctors. But it's what I was arguing, and in fact I know the government supports this position, and all the British Medical Association, all the medical colleges support it, is that we should aim to be self-sufficient in doctors, in that we train enough doctors each year that we actually need. Because one of the things that, one of the problems that rich countries like the UK not training enough doctors causes is it leads to a global doctor shortage. So there's over, the World Health Organization reckons there's about 6.5 million doctors shortage around the world. And that's particularly bad for low-income countries that can't afford to retain or recruit doctors. And so for the NHS, for example, we recruit lots of doctors from countries that have got far more desperate need for doctors than we have, like Sudan, for example. We recruited 500 doctors from Sudan last year, even though Sudan's got 1/10 the number of doctors for the size of the population than we have. So yes, we need to increase the number of training places from 7,500 at the moment to 15,000. We need to open another 15 medical schools. There'll obviously be a bill for this to start with, but one of the points I was saying is that actually the NHS spends so much money on locums, the short-term agency staff that hospitals resort to because they've run out of staff. We spend £6 billion a year on that, the NHS does, and that's a huge waste of money. And if we train enough doctors and nurses, and this argument really applies to all medical specialties. I was focusing on doctors, but actually I think it's a real short-termist thing to say, oh, we're not going to train enough doctors and nurses for now.
Absolutely agree, and it's very much a good example of investing to save. Anthony, I'm sure you would agree as well in the future. But I mean, one of the other things I think, as well as not having enough doctors trained here in the UK, is the fact that some of those that we train in the UK then head off to other countries like Australia, New Zealand and what have you. Do you think there's also a need to have golden handcuffs, as I've called them? In other words, keep our trainee doctors here for a period of time after they've qualified, so 5 years after they've qualified, they then can think about if they need to leave the UK. But really, given that we have trained these young doctors, should they not be operating in the UK?
Well, so I agree totally. And in fact, that's one of the things I raised in my speech. And I copied the idea from the Army, in fact, which so if you train as an Army medic, you're required to, which costs £75,000 apparently, you're required to work for the Army for 4 years. And certainly that sort of scheme, I don't know how long it would be. I said 4 or 5 years. Somebody said, oh, it should be more like 10 years. Clearly, it would be good to look at that sort of thing, and maybe some sort of scale that if you leave, if you leave immediately, you have to pay all your training. If you leave after 10 years, you don't pay any. And if you leave after 5 years, you pay half it or something like that.
Yeah.
But yes, I think you probably do need that, because otherwise you will get taxpayers feeling very short-circuited. They spend £250,000 training a doctor and then they just go and enjoy the sunshine in Australia.
Yeah. Well, the final thing I wanted to speak to you about, we've been talking a lot about levelling up today and after the announcement yesterday. But for those of us who live in remote parts of the UK, and I live in the most western county of the UK in Fermanagh, it's always a challenge to get doctors and consultants to come and base themselves there. Should there not be some way of incentivising that as well for doctors to come to those areas?
Well, this is actually one of the arguments for training more doctors in the UK, because there's been a lot of research on this. The doctors tend to carry on working in the area where they were trained, and and it's very difficult. You mentioned where you live, the same is true in like the northeast of England and other remote areas. It's very difficult to recruit doctors there, particularly if you're recruiting doctors from overseas. And so if you train people locally and you put the medical schools around the country where there are these doctor deserts, as it were. It's a phrase I use, doctor deserts, then their doctors are more likely to stay there after training, and they end up actually they become part of their communities. Obviously, they work in their community, they stay there for their whole career, and you'd have a far more stickiness, as it were, that the doctors are more likely to carry on working there. And at the moment, the medical schools we have in the country are very based in the southeast. So London has 32% of medical training places are in and around London. Yeah, only 17% of doctors work there. You actually need the medical schools spread around the country, so that it's good for the levelling up agenda, and also creates, just having a medical school creates jobs there. Each medical school contributes about 20 million a year to the local economy. So maybe you should campaign for one where you live if you want one.
Well, we did, and we got one in the northwest recently. So, but I did want to bring that issue. Anthony, thank you for Thank you for raising the issue in Parliament. I think it's a very important one, and no doubt one that will continue to be looked at. Thank you.